Have you ever noticed one testicle feels a little different than the other, and quietly wondered if it's normal? You're not alone. As we age, our bodies change in subtle ways, and sometimes those changes hold important clues about our health. In today's video, I want to gently guide you through what testicle size can reveal. Because your body might be trying to tell you something, and it's time we start listening. It's very common for men to notice that one testicle is slightly larger or hangs lower than the other. In fact, for most men, this has been the case their entire lives. Usually, the right testicle is a bit larger, while the left one tends to hang lower. This natural difference in size and position is nothing to worry about, and is simply part of how the body develops. Think of it like your hands or feet. Most people have one that's just a little bigger than the other. The same can apply to your testicles. These small differences are often due to the way blood vessels and the spermatic cords are arranged in the scrotum. As long as the size difference is minor and there are new or uncomfortable symptoms, it's usually completely normal. However, it's important to stay aware of any noticeable changes over time. For example, if one testicle suddenly appears larger or begins to swell, that's not something to ignore. Sudden or ongoing enlargement could be a sign of a medical condition such as a hydrocele fluid buildup, a varicocele enlarged veins, or even an infection like epididymitis. These conditions are often treatable, but they should be evaluated by a healthcare provider. Another thing to watch for is if the larger testicle becomes hard, painful, or feels unusually heavy. These could be signs of something more serious, such as testicular cancer, especially if the change is recent. Though testicular cancer is more common in younger men, it can occur at any age, and early detection is always best. If you're in your 50s, 60s, or beyond, you may notice some gradual changes in testicle size due to lower testosterone levels. This kind of slow shrinkage can happen naturally with aging. But again, if only one side is shrinking or feels softer than before, it's a good idea to get it checked just to be safe. The bottom line is this: a slight difference in testicle size is usually normal and harmless. But if you ever feel unsure, notice new changes, or feel discomfort, don't wait or guess. Talk to a urologist. A quick checkup can bring peace of mind and, if needed, catch small problems before they turn into big ones. Your health is worth paying attention to, even in the smallest ways. As men get older, it's not uncommon for the testicles to slowly become smaller. This gradual change can be a natural part of aging, often linked to a decrease in the body's production of testosterone, the primary male hormone. Testosterone plays a key role in many areas of health, including energy, mood, muscle strength, sexual function, and even bone density. The testicles are the main organs that produce testosterone. When their size begins to shrink, it can sometimes reflect a drop in how much testosterone they're making. For many older men, this decrease is mild and happens so slowly that it goes unnoticed. But in some cases, shrinking testicles may be one of the early signs of low testosterone, also known as hypogonadism. Low testosterone can lead to several symptoms, including fatigue, low libido, weight gain, especially around the belly, loss of muscle mass, and mood changes like irritability or sadness. If you've noticed these kinds of symptoms along with testicular shrinkage, it's worth having a conversation with your doctor. A simple blood test can measure your testosterone levels and help identify if treatment is needed. Sometimes, shrinking testicles can also result from other causes, not just aging. For example, long-term alcohol use, obesity, diabetes, or certain medications, especially steroids or hormone therapy, can interfere with the testicle's ability to function properly. Even conditions like chronic stress or untreated sleep apnea can indirectly affect hormone balance over time. It's also important to understand that testicular shrinkage does not always mean something is wrong. If there's no pain, discomfort, or other unusual symptoms, and your overall health is good, it may simply be part of the natural aging process. Still, staying informed and alert to any changes can help you take better care of your body as you age. If low testosterone is suspected, your doctor may recommend lifestyle changes, such as more physical activity, a healthier diet, and better sleep. In some cases, testosterone replacement therapy (TRT) might be discussed. This is not for everyone, but under the right medical supervision, it can help restore energy, mood, and sexual health for some men. In summary, testicular shrinkage in older age is often linked to lower testosterone levels. While it can be a normal sign of aging, It's also something worth paying attention to, especially if it's paired with other symptoms. The good news is, there are ways to manage and support healthy hormone levels through a combination of medical care and lifestyle improvements. Your body speaks to you in quiet ways. Learning how to listen, especially to small changes like this, can lead to better health, longer vitality, and greater peace of mind. If you notice one or both of your testicles becoming larger than usual, especially if it happens suddenly, it's important not to ignore it. While not all testicular swelling is dangerous, it can be a warning sign that something needs medical attention. One common cause of testicular swelling is a hydrocele. This happens when fluid builds up around the testicle, usually causing painless swelling. It might feel like a water balloon in the scrotum. Hydroceles are usually not serious and often occur in older men. They can sometimes go away on their own, but if the swelling becomes large or uncomfortable, a simple procedure may be needed to drain the fluid. Another possible cause is a varicocele, which is a group of enlarged veins in the scrotum, like varicose veins in the legs. These can cause a dull ache or a feeling of heaviness, especially after standing for long periods. Varicoceles are more common on the left side and can sometimes affect fertility, though many men live with them without any problems. Sometimes, swelling can signal an infection, such as epididymitis or orchitis. Epididymitis is inflammation of the coiled tube at the back of the testicle, and it's often caused by a bacterial infection. It can lead to redness, warmth, and pain in the testicle, sometimes accompanied by fever or burning during urination. Orchitis refers to inflammation of the testicle itself, which may happen on its own or along with epididymitis. These infections need prompt treatment with antibiotics to avoid complications. One of the more serious, but thankfully less common, causes of testicular swelling is testicular cancer. Unlike infections, cancer-related swelling is usually painless and may feel like a firm lump or area of hardness in the testicle. Testicular cancer can occur at any age, though it's more common in younger men. However, older adults are not immune, and early detection is key. If caught early, testicular cancer is highly treatable and often curable. It's also possible for the scrotum to swell due to a hernia, where part of the intestine pushes through the abdominal wall and into the scrotal sac. This may cause a soft bulge that changes size or feels different when you cough or strain. The most important message here is this: if you notice new or unexplained swelling, don't delay seeking medical advice. Even if it's not painful, changes in testicle size or feel should always be evaluated by a doctor, especially if they develop suddenly or worsen over time. As we age, paying close attention to our bodies becomes even more important. Swelling may be harmless, but it can also be that something deeper is going on. By getting it checked early, you give yourself the best chance of staying healthy, safe, and in control of your well-being. As men grow older, many start to wonder if changes in their body, like testicle size, could affect their fertility. While it's true that age naturally lowers fertility, the size and health of your testicles can provide useful clues about your body's ability to produce healthy sperm. The testicles have two main jobs: producing testosterone, the male hormone, and making sperm. Generally, healthy testicles are oval-shaped and firm but not hard. In younger men, slightly larger testicles are often linked to better sperm production. But as men reach their 50s, 60s, and beyond, it's common for the testicles to shrink a bit and for sperm quality to gradually decline. That said, many older men can still father children. However, smaller testicles, especially if the change is noticeable, may sometimes be a sign that sperm production has slowed or reduced significantly. This doesn't always mean infertility, but it could mean the body is producing fewer or less active sperm. If fertility is still a goal, or if you simply want to understand what's happening in your body, a semen analysis or hormone test can offer helpful insight. There are other factors that can impact testicle size and fertility as well. Lifestyle choices, like heavy alcohol use, smoking, poor diet, or lack of exercise, can negatively affect testicular function over time. Medical conditions such as diabetes, obesity, and chronic stress can also interfere with hormone balance and sperm health. In these cases, the testicles might become softer or smaller, sometimes without any pain or other symptoms. Certain medications, like long-term use of testosterone supplements or steroids, can also lead to testicular shrinkage and reduce fertility. That's because when the body gets testosterone from outside sources, It may slow down or stop its own production, causing the testicles to shrink due to inactivity. This is something many men aren't aware of, and it's why hormone therapy should always be supervised by a knowledgeable doctor. It's also important to keep in mind that testicle size alone isn't a perfect indicator of fertility. Some men with smaller testicles still produce enough healthy sperm, while others with normal-sized testicles may face fertility challenges for other reasons. That's why it's important to look at the full picture, including hormone levels, lifestyle, and medical history. If you're noticing a change in testicle size and wondering how it might relate to fertility or overall health, the best step is to speak with a urologist. They can perform a physical exam and, if needed, recommend simple tests to assess your reproductive health and hormone function. In short, testicle size can offer valuable clues about fertility, especially in older age, but it's just one piece of the puzzle. Staying informed, living a healthy lifestyle, and talking openly with your doctor can help you make confident decisions about your health and future. Although testicular cancer is more common in younger men, older men are not immune. That's why paying attention to any unusual changes in the size, shape, or feel of your testicles is important. No matter your age, one of the first warning signs of testicular cancer is a painless lump or swelling in one testicle. Unlike infections or injuries that often come with pain, cancerous changes in the testicle are often silent at first. You may notice that one testicle feels heavier, firmer, or slightly larger than before. It might seem as though the testicle has grown, or it may lose its smooth shape and become more rigid in one area. These changes usually happen slowly and without discomfort, which can make them easy to overlook. It's important to know that not every lump or swelling means cancer. In fact, many conditions that cause testicular changes, such as cysts, varicocele, or hydrocele, are benign non-cancerous. However, you can't tell the difference just by feel. That's why it's essential to get any new or unusual change checked by a doctor, especially if it lasts more than a couple of weeks. A simple physical exam and an ultrasound can usually determine whether a lump is suspicious. If needed, blood tests and further scans can help with diagnosis. The good news is that when testicular cancer is caught early, it is one of the most treatable forms of cancer with high cure rates. Even in later stages, older men sometimes assume that they're past the age where testicular cancer is a concern. But while the risk is lower after age 50, it doesn't disappear. And because older adults may not routinely check their testicles or may feel hesitant to mention these concerns, warning signs can be missed until the disease has progressed. That's why a monthly self-exam is a healthy habit any age. It only takes a minute. After a warm shower, gently roll each testicle between your fingers, feeling for lumps, swelling, or changes in firmness. If something doesn't feel right, don't panic. But don't ignore it either. A quick visit to your doctor can give you peace of mind or catch something early, when it's most treatable. Also, be aware of other symptoms that can occasionally accompany testicular cancer, such as a dull ache in the lower abdomen or back, a feeling of heaviness in the scrotum, or even unexplained fatigue or weight loss. In short, unusual testicle enlargement, especially if it feels firm and painless, should never be brushed aside. You know your body best, and even subtle changes deserve attention. When in doubt, get it checked. It's a simple step that can make a powerful difference in protecting your health. As men age, it's natural for the body to go through changes, but not all changes should be ignored. When it comes to your testicles, knowing when to see a urologist can make a real difference in your health, comfort, and peace of mind. Many men notice small differences in testicle size or shape over time. A slight change is often harmless. But if a testicle becomes suddenly larger or smaller, feels firmer or heavier, or develops a lump or swelling, it's time to talk to a doctor. These changes could be signs of a minor issue, like a fluid buildup, or something more serious, such as an infection or even cancer. The key is not to guess. Other signs that warrant a visit to a urologist include persistent pain in the testicles or scrotum, a feeling of pressure or heaviness in the groin, redness, warmth, or tenderness, any lump. Even if it's painless, changes in the way your testicle hangs or feels. It's also important to schedule a visit if you've experienced an injury to the area, or if you're dealing with fertility issues or signs of low testosterone, like low energy, reduced sex drive, or mood changes. A urologist can assess whether your testicles are functioning properly and recommend treatments, if needed. One of the biggest reasons men avoid seeing a doctor about testicle issues is embarrassment or the belief that it's probably nothing. But the truth is, early detection saves lives. Many testicle-related conditions are easily treatable, especially if caught early, and a short, simple visit to a urologist can often provide reassurance or identify a problem before it becomes serious. Seeing a urologist doesn't mean something is wrong. Think of it like going to the dentist or getting your blood pressure checked. It's a routine part of keeping your health on track, especially as you age. If you're over 50, it's a good idea to be even more proactive. Just like regular prostate checkups, staying aware of testicle health is part of a complete approach to men's wellness. Your doctor might recommend imaging like an ultrasound, blood tests, or even hormone panels depending on your symptoms. These are simple, non-invasive tools that provide clear answers. Remember, you're not being overly cautious. You're being wise. Taking action shows strength, not weakness. Your health is worth it, and you deserve the same attention and care as any other part of your body. So, if you've noticed something that seems different or just feels off, don't wait. Make an appointment with a urologist. A quick conversation can bring clarity, relief, and the confidence that you're taking the best possible care of yourself. Your health is too important to ignore. If you noticed anything unusual, or if you just want peace of mind, don't hesitate to talk to your doctor. And if you found this video helpful, please give it a thumbs up, subscribe for more trusted men's health guidance, and share it with someone who might need this information. Let's take care of ourselves and each other with confidence and care.